I am presenting on behalf of the co-investigators on the CRB-401 study, which is the Phase I study of ide-cel or Idecabtagene Vicleucel. And as this audience is well aware of, the pivotal Phase II trial with KarMMa-1 study is still ongoing, and Dr. Munshi had presented results on the KarMMa study earlier this year at ASCO. So at ASH this year, we're able to present outcome for the complete group of 62 patients treated in the Phase I CRB-401 study, as well as longer follow-up with a median follow-up about 18.1 months for this patient population. The first 33 patients treated on the study, that result, the earlier result was already published in New England Journal of Medicine in 2019. So now with the entire cohort of 62 patients, and again, as confirmed by the patient population generally that we have been seeing in the ide-cel studies, these are high-risk patients with close to a third of them having high-risk cytogenetics, more than a third of them having extramedullary disease. Half of these patients needed some type of bridging chemotherapy while their CAR T cells are being made. And over 70% of these patients were triple refractory and refractory to their most recent line of therapy before coming onto the CRB-401 study. So for these patients on this study, what we are continuing to see is that this is a well-tolerated CAR T product. Overall, the incidence of any grade cytokine release syndrome is about 76% in this patient population, but grade 3 or higher CRS is quite low at only 6.5%. Similarly, any grade of neurologic event is around 35%, but only one patient had a grade 4 neurotoxicity. So for this entire cohort, what we're seeing now is that the overall response rate is 75.8%, and CR and stringent CR response rate is 38.7%. We are seeing with the range of dose tested that there is an increase in response rate with increasing dose of CAR T. And so far with, as I mentioned, 18.1 months of median follow-up, the duration of response is 10.3 months for the entire group. For some of these patients who are still continuing on the study, we're seeing duration of response even beyond 2 years. When we look at the dose that was moved forward for the KarMMa-1 study, so formal testing in the Phase II study, that is the 150 and 450 million cell dose. We are seeing that there is actually no difference in duration of response in these higher risk situations, such as older patients, patients with a higher ISS score, patients with extramedullary disease, and patients who received bridging therapy. The progression-free survival is 8.8 months, and the median overall survival is 34.2 months. We're also seeing that this ide-cel does persist in patients and can be detectable in the blood for many months post-infusion, and that the expansion of these cells are correlated with CR response. So this is very encouraging data. The BLA has already been submitted to the FDA based on the KarMMa-1 study, and we're anticipating FDA review in early part of 2021. So this could potentially be the first CAR T coming into myeloma space. And so it's very exciting that with a single dose of ide-cel and no need for maintenance therapy in this heavily pretreated patient population, we're seeing a high response rate and a nice PFS as well as OS in this population.